Yeah. Remember something.
How many Lupus does it take for a webinar? Clearly, at least 3. And a note, and a sticky note. That's the answer to every joke on how many Lupus and a sticky note. Okay. It's always good to start off with Lupus jokes. So welcome to our webinar on your eyes and lupus. Today we have Natalee Crook-Carter here with us from Friends for Sight, and she's also a fellow Lupi, and she has a plethora of information on lupus and your eyes. And I hope by the end of the evening we will all know far more than we need to know about lupus in our eyes. Are people free to ask questions as we go through, or do you want people to wait till the end?
Nope, free to ask questions.
Okay. So just interrupt if you have questions. So I'm going to turn it over to Natalee, and she can introduce herself and get going.
So thanks everybody for joining. It's actually quite refreshing to be hanging out with fellow Luppies. It's rare. We're usually the only ones.
Yeah,
so
yeah. And people don't talk about
cool.
it, so you know it's not often that you get a room full of people who also admit that they have lupus.
So of course I'll start out by just mentioning that I am not a doctor. I'm a certified ophthalmic assistant. So of course I have hopefully some good information for you, but I cannot give diagnoses or medical advice necessarily. But I'll definitely ask if you for recommendations, or if you, I'll definitely do what I can as far as answering questions.
Oh, that really, that's slow.
So of course we have to start out with just some fun, because really we are all so awesome that even our immune systems can't get enough of us.
The epitome of lupus.
Exactly.
Oh, yeah, you're welcome to do it. Sorry.
So as we know, lupus is a chronic autoimmune disease which can affect the eyes in up to a third of patients. Not only can these issues cause significant vision problems, but it can actually also show signs of underlying systemic disease activity. So it really is important to just have annual exams, even if you don't have any problems. Maybe you're lucky and you don't actually wear glasses or need correction. It's still, as far as just kind of your annual healthy exams, just to get a good dilated eye exam, because you never know if something's going to kind of pop up that you don't actually have symptoms for, that can maybe catch, maybe that you're on your way into a flare, or who knows what kind of activity is going on.
I have a question.
Yes.
It seems like lately, when I've gone to just the regular ophthalmologist, they're not dilating my eyes anymore. Is that because they do the air pressure test?
Mm-hmm.
So is that in place of dilating?
No, that's the air pressure test is to check your
different.
eye pressure.
Okay.
But dilating is actually the drops that dilate your pupils, so they can actually look in the back of the eye, in the retina, which is really important for lupus.
So Costco hasn't been checking dilating my eyes.
How often do you go?
To once a year.
Yeah, so I think at Costco it's actually an optometrist and not an ophthalmologist, which we will actually get into. Okay. But as an advocate for yourself, if you go annually, you should absolutely ask.
Okay, and they can
for a
do
dilated
it
exam.
Okay.
Absolutely, yes,
okay.
Yes.
Good to know. They didn't even ask you if you want it.
No, what interesting that they don't. That's really weird.
Do they usually? Is that usually what happens? If they ask you if you
want it? They do, and maybe it's a little bit of a difference because you probably go to your optometrist just for correction.
Right. So
it is. They just might be kind of in routine.
Okay.
Yeah. They might not be being super thorough by saying, "Oh, but she's actually this patient here. Remember, she actually has lupus and other medical."
That's a good thing to remember, because you just kind of go and do what they say.
Yeah, and it is a pain. Nobody wants to get dilated, but
you don't want to
it really is important. So these are just kind of basic, useful tips to help protect your eyes and vision that really everybody, not necessarily just patients with lupus, but everybody should kind of go by. So of course, first we've got, you want to maintain your annual dilated eye exams, which we just talked about. Know your family history of eye disease, which is a really good one. There's many times that, and sometimes you have no idea. Some families don't talk about that kind of stuff, but it really is important because there's quite a few eye diseases that are hereditary, and one of them is glaucoma, that is kind of known to be the thief of vision because you don't have symptoms until you've actually lost your vision and it's irreversible. Macular degeneration is another one that almost, they say, everybody, if you are old enough, will end up with macular degeneration, but definitely more common if you've got somebody in your family that has it. So maybe start asking around, not only with eye disease, but disease of your ancestors and family history. And of course, general good, stable health. Anytime that you, obviously with us, we do our best, but anytime you have any kind of inflammation in your body, you can get inflammation in your eyes. Blood sugar issues, if you're diabetic, if that's up and down, that can be really, really hard on your eyes as well. Quit smoking. There's obviously lots of reasons why that would be a good thing. As far as with eye health, they've done some studies that actually show that you have an increased chance of getting macular degeneration if you're a smoker. Always wear your sunglasses. Wear eye protection, safety glasses. If you're doing, anything outside, even yard work, anything that can be damaging, cause anything to kind of flip up into your eye, firework hazards, fire hazards, lots of stuff. Wear your contact lenses properly. There's many times that whether it's patients just really can't afford to replace their contact lenses, overwear of contact lenses is very common, but it is very, very scary and can cause some major infections. And even I've seen patients who actually end up needing a transplant because of overwear with contact lenses or not cleaning them properly. And the last one is to follow the 20-20-20 rule, which is every 20 minutes, take a 20-second break to look 20 feet away, especially if you're on the computer, looking at your phone, you're reading, you're actually less likely to blink 50%. So that will dry your eyes out and kind of cause a little bit of eye strain. So, because everybody has time every 20 minutes to take a little 20-second break.
It makes sense, yeah. It's sad that we need those reminders,
I know.
But yeah, you get.
And I know that would probably never happen, but do your best.
Yeah. Great.
Any questions, anybody yet? Okay, move on. So when we'll go to the difference between an optometrist and ophthalmologist, which is a very common misunderstanding. So an optometrist is, usually they'll have the initials OD after their name, is a healthcare professional who provides primary vision care. They are not an actual medical doctor. They are licensed to practice optometry, which primarily involves performing eye exams and vision tests, prescribing and dispensing eyeglasses and contact lenses, detecting certain eye abnormalities, and prescribing medications for certain eye diseases. However, every optometrist is a little bit different. There are some optometrists that only really deal with doing correction. They'll just do kind of a general eye exam with dilation and give you a prescription for contacts and glasses. If you have any abnormalities they see, or even if it's an infection, some of them will actually refer you to an ophthalmologist before treating. So it's really different. Kind of every optometrist is very different. There's also other optometrists that kind of go into even further testing. That's kind of like more of ophthalmologists. Usually you'll find that in an ophthalmology practice. So if you have an optometrist, maybe even see if they kind of have a specialty in some area. There's some that do a specialty in like vision therapy for patients who have amblyopia or eye muscle issues. Amblyopia is where one or both eyes is significantly decreased in vision because of usually a brain issue. But so just quiz your optometrist on what they do and what they do not do. But more importantly for lupus is really to see an ophthalmologist. So an ophthalmologist is a medical doctor who specializes in eye and vision care. and they diagnose and treat eye diseases. They also perform surgery and prescribe medication not only for eye diseases, but also systemic issues that they might find in your actual eye exam. They also prescribe eyeglasses and some prescribe contact lenses, but that's another one you want to quiz your ophthalmologist, because not all ophthalmologists will actually do contact lenses, because it's actually have to do with special fitting for those. That a lot of ophthalmologists, they do their specialty in another area, and contact lenses isn't one of them. And some ophthalmologists have even a subspecialty in a specific area, like they're an ophthalmologist, but they're a cornea specialist or a retina specialist, glaucoma, etc. So sometimes you'll actually see kind of a general ophthalmologist, and if you've got something specific that they find in a certain area of your eye, they'll actually refer you to another ophthalmologist, but it's because they actually have a specialty in that specific area.
Would you say ophthalmologists have a better understanding of lupus complications with the eyes?
For the majority, yes.
Okay.
Most, I do know of a few optometrists that really have kind of the same understanding and know the importance and actually have the proper testing, and would be great to go to, but in general,
you're better off.
You're better off as an ophthalmologist, yeah. And not that optometrists aren't amazing, because they really are, but for things that we really need to make sure that our doctors are paying attention to, it is best. Another comic. I'm returning these glasses I bought for my husband. He's still not seeing things my way.
Eye humor?
Eye humor. Mm-hmm. I guess it's funnier if you're an eye nerd like me.
I bet you have an office covered in eye comics.
So as we kind of discussed a little bit, annual comprehensive eye exams are recommended for people with lupus, especially for anyone taking good old Plaquenil. As a precaution, people treated with Plaquenil should get a baseline eye exam before or soon after starting the drug and visit an ophthalmologist annually. Long-term Plaquenil users on high doses will need to monitor eye health regularly to prevent retinal damage from long-term use. We're going to go into Plaquenil a little bit more too. So in case anybody, but if you have a question?
Right.
Okay.
Holding on to it.
So we're just going to start out with a little bit just really simple eye anatomy, because we're going to start talking about really kind of areas of the eye that lupus can affect the most. So, and we can go back if you guys want to this little model, so I can kind of show you exactly where it's affected. So really what we're going to mostly be talking about is your cornea. So if you've got dry eyes, it really usually affects your cornea. Of course, with Plaquenil, inflammatory issues is your retina, which is really kind of more known as the back of the eye. And so what you see where it says retina, the macula can be affected. We'll also talk about the optic nerve. And what else are we going to talk about here? We talk a little bit about the sclera, but I don't want to get too complicated here to start with.
Where does inflammation occur in the eye?
It can actually occur anywhere in the eye.
Well, that's an easy answer.
Yeah.
Okay, then.
Unfortunately, huh? So we'll start with the most common eye problems that are associated with lupus. The first one is dry eye syndrome, which most people who live in a desert environment like Utah do have some sort of dry eye, but because of our awesome immune systems, we are definitely more prone. So obviously dry eye syndrome, and kind of like simply termed, is a lack of tear production or poor tear quality, but it can also actually be a tear duct issue, or even your glands aren't producing enough oils. There's lots of different, if you want to, that we could really go into. Symptoms of dry eye are irritation, stinging. Sometimes it actually does feel dry. Sometimes it actually feels wet, which is very confusing to some patients. Burning, stinging, scratchy, redness. Normally with this treatment for dry eye syndrome is fairly simple, is with use of artificial tears, lubricating artificial tears, gel, or ointment if it's kind of in more severe cases. Also, the other option is to actually have punctal plugs placed in your tear ducts, because your tear ducts actually act as a drain. So sometimes if you actually have those plugged, it helps keep moisture in your eyes. They actually work very well. Or prescription eye drops. Another good thing too that actually helps with dry eye syndrome is to use kind of warm compresses that you can use kind of in the morning or at night that kind of get your glands going. It's another option that's actually doesn't cost anything, which is always a nice one.
Yeah.
Also, to be careful with, not having fans kind of blowing air in your face. Watch when you're in the car.
Yeah.
Sleeping with a fan is a huge problem, which I'm always roasting at night. So,
Yeah.
but that'll really dry your eyes out. The other, actually, a really severe form that a lot of Luppies actually have too is Sjogren's syndrome, which is actually its own autoimmune disorder that affects moisture-producing glands. And really, the symptoms on that are really the same as dry eye syndrome, but you can also have dry eyes and mouth, skin, scalp. They usually say it's your mucous membranes that are dry. They can be pretty severe enough that it'll end up kind of internally as well. Treatment for that is the same pretty much as dry eye syndrome, but there is an actual prescription eye drop that doesn't necessarily work for everybody, but has really helped quite a few people.
No.
Oh, is that what it was? Was a question?
Yeah. No, that was an update.
Oh. Melinda, are you asleep?
When you use the fan?
And are you sure that your eyes are closed completely?
Oh, that's a really good question.
While you're sleeping, because a lot of times patients' eyes aren't necessarily completely closed while they're sleeping.
So Melinda just asked a question over on the side, for those of you who haven't seen it. She said, I use a fan, but my eyes are closed when I'm sleeping. Why does it matter? Which is logically a really good question.
However, when you're sleeping, you don't really necessarily know that your eyes are completely closed. So you still might get some air and some dryness.
Makes sense.
Dryness in there.
Okay.
Okay.
Sounded like you have a question?
I do have a question. My eyes constantly water. They're constantly watering.
Mm-hmm.
But my eye doctors have never said anything. What's the best way to address that?
When you first go actually to the doctor, and they will either have you fill out your paperwork or ask you specifically what you're there for, make sure you actually mention that even if it's whether that your eyes are constantly watery, because a lot of times that can be a sign of dryness, because your eye is actually trying to overcompensate for the dryness, so it's producing extra tears that can cause watery eyes. And when you're at the doctor, sometimes they'll, it might not be super significant on the exam at that time. You notice it like a certain time of day when you're on the computer.
You know what? It used to be just like in the morning or towards the end of the day, but now it's all day long. All day long, my eyes water, and people often stop and like, "Are you crying?" And I'm like, "No, my eyes just water all the time." And I've been sitting here just wiping my eyes because they're just constantly draining.
Yeah, I would definitely, because there could be a number of different things. So usually, more commonly, they're actually really dry and it's overcompensating.
Mm-hmm.
But you can also have plugged tear ducts, so that there's nowhere for them to drain.
Because I see an ophthalmologist on a regular basis that has keratoconus.
Oh, yep.
But he really only concentrates on that.
Yeah. And with keratoconus, it is tough because it is such a compromised tissue that it would be easily overlooked if you had some dryness.
No, it's a good question.
Yeah, that's a very good question. Another common eye problem is eyelid disease, which is more often related to discoid lupus because it's a kind of a skin issue. But symptoms of that are raised scaly lesions or crusting on the eyelids and the lid margins, which really, your lid margins is right where your lashes are. Sometimes you'll see too that your eyes are really red, kind of feels like you've got something in there. A lot of times patients will usually have kind of a flare, so to speak, after, of course, an exposure or air toxins being in cigarette smoke. Normally, eye drops don't really help this, or even topical. A lot of times people will think topical steroid. It's kind of dangerous.
I was going to say, they
to
usually
use.
say don't
Yep,
put near your eyes.
exactly, near your eyes. So usually they'll just, it is treated with oral steroids.
Treat it from the inside.
Right. And a nice dry eye comic. This is Dr. Gray's controversial method for treating dry eyes by telling his patients mean things to make them cry.
Ah,
That's pretty terrible.
that's pretty cute. I like it. That's really cute. I love it.
That one was courtesy of a local ophthalmologist, so everybody knows.
You gotta keep yourself entertained.
Right.
We've heard every lupus joke here.
I'll bet. So another common eye problem associated with lupus, I think you probably hear more of this than any other symptom or any other issue, is a retinopathy and damage to the retina, which is, we talked about kind of the back of the eye. This one is usually correlated with the use of Plaquenil, but you can also get retinopathy without use of Plaquenil just because of inflammation. So don't think that you're out of the water
If you're
regardless, right? And you know, I also want to say that we talk about kind of symptoms and treatments. Everybody's really different. Somebody might not have any of these symptoms that we talk about, and it might be something else. Or sometimes they won't have any symptoms. Different doctors do different medications or different kind of treatments for everything. So again, that's why it is super important to have an annual exam, because you just never know. You know, you might be like, you know, I noticed maybe my color vision was a little bit funky, but I just thought I was tired. I just had a flare, didn't think anything of it. You come to find out you've got something seriously wrong that could have been taken care of if it was caught soon enough. But you don't want to wait.
I think most lupus patients know that symptoms can vary. So, I mean, they've personally experienced how the varied symptoms, or that they didn't realize something was a problem because they were so used to it.
Right.
So it's even more reason to
Right.
make
Absolutely.
sure that you're getting checked.
Absolutely. So more common symptoms of retinopathy are blurry or distorted vision, decreased peripheral vision. So maybe your central vision, so if you look straight ahead, is fine, but your peripheral vision is kind of off, or you're not noticing something that's right next to you. Floaters, which I don't know if some of you have noticed, especially if you're looking at kind of a white wall, your computer screen, or the sky, you'll see kind of a little microscopic something go by, which most people have commonly, just on average, depending on the patient and even your prescription. The higher your prescription, the more likely you are to actually have floaters. But what you want to watch for is if you notice all of a sudden a increased amount of floaters, all of a sudden you're noticing a whole bunch, or like somebody threw pepper in your eyes, or if they're all of a sudden really big. You may notice something that's like really big, or they'll even be, sometimes they'll float in your line of vision and stay there for a little bit, which is
Good
another
warning.
sign.
Yeah.
Another issue too with a retina, that's associated with retina issues, is especially if you have floaters and flashing lights. So it's almost like somebody's flashing a kind of flashlight in your vision randomly. Those are some big red flags.
You should go to the doctor right away if you have
Absolutely, yes.
Okay.
Call right away. Normal treatment, common treatments, of course, for retinopathy is the usual systemic medications that we're already on, immunosuppressants and corticosteroids. For more severe treatments, they'll actually do a laser therapy that is actually a kind of a surgical procedure that they just kind of use a laser to mend whatever the issue is in there. It's actually it's outpatient, fairly easy. Sometimes they'll even do it just right there in the office, and or an anticoagulant.
So do you know if
like a
people
blood
who
thinner.
have so if people have the antiphospholipid antibodies, if they have antiphospholipid syndrome, should they make sure their ophthalmologist knows that?
Yes.
Okay.
Yep. Because they are obviously going to be more prone to a blockage, which is kind of what's going on in the retina anyway. It's somehow there's arteries and veins that become blocked. And if you have that syndrome, obviously you have more of a higher chance of having that kind of a blockage or a blood clot really in your eye is almost kind of what it is.
What about like self-testing? Can you do like, is there anything that you can do to like maintain that your vision and like, for example, like what is the Amsler?
The Amsler grid?
Yeah.
That actually is kind of an old school test that we used to always do in clinics that kind of has died out a little bit, but it is actually, I'm glad that you brought it up because that is actually a great tool at home. Maybe I'll even find some kind of a picture that we can, or something that people can download off of the website later.
Sure.
Because that is, I'm glad you brought that up because that actually really is, we rarely use that in clinics. Well, depending on what clinic you work at.
Color books with the squigglies in them.
Yeah. It's just a color, like color plates.
Oh, okay, color plates. Okay,
yeah.
So color plates.
Color plates.
The Amsler
and the color plates, I don't know if that would be a good measurement. Just because they're a little bit difficult anyway, and then some of the colors on it are a little bit muted. I don't know if you would actually notice that big of a difference with the color plates, but the Amsler grid would be a great tool at home. So basically, an Amsler grid is just a piece of paper that is a grid that you can look at. A lot of times they used to have, and you probably could find it on Amazon. I'll look it up. But we used to have them at the clinics where it was a magnet, so you could just put it, especially for the retina issues, macular degeneration problems. You just have it right on your fridge. So you stop every day, take a look at it. If any of the lines are distorted, if you've got a spot in your vision that's missing, you could probably even more apt to notice floaters. In that case, that would be a really good tool.
From what distance would you use it?
You can really use it to any distance, and it kind of depends on each individual patient and what your vision is and what you're comfortable with. But normally you'd want it maybe 16 inches. But again, if you have issues with reading, kind of what you're comfortable with, and you want to make sure that you're doing it at the same distance. You don't want to one day be looking at it 5 inches away and then the next day looking from across a room.
Yeah, that makes sense. No, that'll be great. We'll link it when we load this on the website.
Perfect.
That'll be great.
Perfect. Yeah, glad you brought that up. So if, like we kind of spoke about earlier, if you have these types of symptoms, you want to call as soon as possible. In mild cases, if it's caught soon enough, usually if there is vision loss, a lot of times that can be restored. In moderate cases, and it's kind of based, patient based by case, vision loss, you might even experience like not necessarily a complete loss of vision, but you can kind of have a curtain over your vision or lose quite a bit of vision, but again, can be restored if caught early. If you wait too long, usually it's permanent. So again, very important.
Scary.
Yes. So we'll move on to less common eye problems associated with lupus. The first is scleritis, which is inflammation of the sclera, which is actually the white part of the eye. And with this, it's another kind of just inflammation kind of an issue. But the symptoms of scleritis it's severe eye pain, extreme light sensitivity, blurry vision, and it can be really watery. Usually with treatment, they'll just treat with oral medication or prescription eye drops. With this type of scleritis, that can cause permanent vision loss, especially if it's not taken care of fairly early. With this type of a issue, it's unusual, I guess, depending on your pain tolerance, because it is very, very painful.
Is it?
It's almost excruciating. So most people, it's usually found.
Does it come on like all at once? That people wake up one morning with horrible eye pain?
No, actually, that's a great question, because with this type of issue, with this scleritis, it actually is it starts out a little bit mild and then gets worse.
Okay.
However, with episcleritis, it's different.
Interesting. Okay.
So an episcleritis, that's simply the inflammation of the episclera, which is the outer portion of the sclera. If we really got into it, it's kind of confusing. on where like the white part is actually your conjunctiva, but then the sclera is kind of the layer that's around it, but you can actually get inflammation inside. So with episcleritis, you will get redness, some mild discomfort, which some people may or may not get. You might just have somebody come in with like, oh, I woke up this morning and my eye is bright red and it's tearing, but I don't have any pain, but they actually have this, or tearing or pain, but they actually have this issue. Usually this will actually go away on its own, and usually doesn't really.
And do these things usually happen in both eyes at the same time, or can people have it in just
nope,
one eye?
Nope, it can just be in just one eye.
Okay.
Yep. Another less common eye problem associated with lupus is optic neuritis, which is inflammation of the actual optic nerve. Symptoms of this is blurry or dim vision, or pain in the back of the eye, or with movement. It's almost kind of like an achy pain, and if you kind of move your eyes around, you'll feel a little bit of achiness in that too. Usually in mild cases, what do I have on here? Very mild cases may require treatment, oral medication. I think very mild cases don't necessarily require treatment, is what I meant to say there, or oral medication. If it's not taken care of, obviously it can cause permanent vision loss. The other is ischemic optic neuropathy, which ischemic is lack of blood flow. So this is damage to the optic nerve due to blood supply blockage. And it's almost like a stroke in your eye that ends up to your optic nerve. So obviously this would cause permanent vision loss. Symptoms of this would be like sudden darkening vision that actually might return to normal for a few seconds, and then you'll lose it again, or it would become blurry or distorted. And of course, oral medication, usually steroids, and or if there's suspicion of definitely a blockage in there, they'll prescribe an anticoagulant blood thinner.
And is that usually a lifelong person that's a candidate for lifelong anticoagulant therapy? You know, or
not necessarily.
Okay.
It's just kind of on kind of a patient case by case.
In lupus, there's not often a standard of care
Right.
anyway,
Right.
So
Yep.
probably comes down to the doctor, what the doctor wants to.
Exactly. And it would be even you would have a higher susceptibility if you also obviously had the antiphospholipid syndrome, if you have high blood pressure, if you already had kind of issues with kind of a coagulation problem anyway, or high risk for an actual stroke as well. Now we'll move on to rare eye problems associated with lupus, luckily. And the first is iritis, which is inflammation of the iris, which is the colored part of your eye. Symptoms of iritis is really, the biggest one is actually redness. Your eyes are actually quite red. Discomfort, aching, light sensitivity, and blurry vision. And normally they'll treat it with eye drops. A lot of times they'll do either like a steroid eye drop, and or because your iris is actually like a muscle and becomes inflamed, they'll actually sometimes, very commonly actually, is prescribe a dilating drop so that it almost like paralyzes your iris, so it's not moving back and forth and causing the pain. Yeah,
makes sense.
So in that case, if your pupil is huge, you're letting a lot of light in.
Right.
So you have to make sure you wear sunglasses with that as well.
Careful.
The other is uveitis, which is inflammation of the uvea, which is actually the middle layer surrounding your eye.
Okay.
It is confusing. Symptoms of this is redness, pain, extreme light sensitivity, blurry vision, and sudden onset of floaters. This is kind of a tricky one that, as us luppies know, sometimes get misdiagnosed. So it might be like, well, you might be iritis, it might be just some strange inflammation. I'm not sure what's going on. Normally with this kind of a situation, from what I've seen anyway, it can be fairly complicated, but we're lucky that in Salt Lake we have a ophthalmologist who is a uveitis specialist. But sometimes this would take a lot of, obviously with treatments, it's prescription eye drops and oral medication, a lot of follow-ups, because it will take some time to get the right medication. We're well known with that kind of stuff as well. But this kind of thing will take quite a few appointments and follow-up.
We've had people come from surrounding states that have contacted the foundation, come to go to specialists here, particularly for this. Yeah.
Interesting.
So, yeah.
Huh. Yeah, we're lucky actually with the medical field that we've got in Salt Lake for sure. So we'll move on to side effects from medication, kind of common medications that we Lupus take a lot. So of course, corticosteroids. The biggest issue with this is cataracts, which is not really that big of an issue. It's actually one of the easiest fixes. So it's clouding of your natural lens, and especially at high doses and or long-term use. But not necessarily, because there's actually can be fairly common for patients who aren't on high doses or have ever had high doses, but long-term, or opposite, that one time they were on high doses for 3 days.
Really?
And not long-term, and they can already have starts of cataracts. Cataracts are tricky. Usually the type of cataracts, different types of cataracts, and the type of cataract that usually comes from steroid use is kind of a fast-growing cataract, but you never know. Sometimes cataracts will take 6 years to grow. So it just kind of starts out symptomatically as cloudy, blurry vision. Sometimes people feel like they're looking through a screen or literally like a cloud. Some patients feel like things start looking yellow or beige. Glare with lights is a huge one, especially at night when you're driving and headlights. It becomes difficult to drive. So that's, of course, the decreased in dark or dim environments at night. And also reading, trying to read something in dim light is another sign too. It'll just slowly gets worse. Your lens just gets more cloudy, almost like an old window. So you'll notice, it gets more cloudy, kind of, you have a hard time kind of seeing through it. Like we kind of talked about a little bit, that it might be fast growing, or sometimes it can take 5 to 10 years to really kind of get to the point where they'll actually want to do surgery. But it is probably one of the most simple surgeries out there. And if you have, right now, there's quite a few different lens options. So they'll actually replace your natural lens with a prosthetic lens that's close to your prescription as possible. So for some people, it's almost like having your insurance pay for refractive surgery. So it's kind of a win-win situation. Another issue that is talked about, especially online a lot, it's not really talked about a lot in actual ophthalmology clinics, is steroid use that can cause increased eye pressure, or online it will say glaucoma. But this is actually rare, and actually found more often with steroid eye drops, and particularly after eye surgery. But it's still not very common, but we do see it. So for instance, for us Lupus, when we do, I should say more often, when we end up having cataract surgery, you've got a really good ophthalmologist to kind of watch closely to make sure that your pressure doesn't increase, or because we have more inflammation in our eye than your average patient, so they kind of watch closely on that and make sure that you're getting your pressure checked, especially for the topical steroid eye drops, but not necessarily because you're on oral medication. And we'll move on to the big, it's Plaquenil, so of course it's a lot of information. So we talked about retinopathy a little bit. So one of the other issues that actually we can get a side effect from Plaquenil that is a little bit less talked about is actually a corneal issue called vortex keratopathy, where it's actually deposits in your cornea that actually look like a whorl. I hate to say because it's a problem with medication, but it's actually kind of cool looking. The good thing about this is that it usually does not require treatment and usually resolves after you discontinue the medication. Also, most patients don't really have any symptoms. It's not really doesn't cause visual problems normally. Obviously, with some symptoms that are kind of more severe cases that patients have experienced are halos around light, decreased visual acuity, which is your blurry vision, or light sensitivity. Obviously, I didn't edit that to not be medical terminology. I apologize about that one. But again, normally most patients don't have symptoms, and it will return
Do those
to normal
people,
after discontinuing medication.
should they never take Plaquenil again? Are they pulled off for life usually?
Not, it wouldn't be for this cornea issue.
Okay.
Why they would more likely be because of a retina issue,
Okay.
that they would be pulled off of it for life. So obviously we talked about retinopathy a bit earlier. With this type of retinopathy that is more common with Plaquenil use is actually called bullseye retinopathy or maculopathy, and it might have a little bit different types of symptoms than just from inflammation. A lot of patients don't experience symptoms initially, but then it can progress into vision distortion, blurry central vision, change in color vision, central blind spots, difficulty reading, and decreased night vision, especially with the visual distortion. Blurry central and central blind spots would be important to have that. So read that Elliot. Is it Elliot?
Mm-hmm.
How did I think? Sorry. I was trying to make sure I was saying your name right. That she brought up. That would be actually really a good thing to have and to test. But again, the reason why it would be important to have annual eye exams, because you might not have any symptoms and have something going on back there. And then treatment for this is, if it's caught early enough, vision can normally be stabilized by discontinuing medication, which I know is very difficult because obviously it's what's keeping Lupus systemically healthy. So like, this is another good reason to have a good relationship with your rheumatologist and your ophthalmologist, so that you're not, one person's telling you get off of it, the other's telling you no. Anyway.
They each have their own
right.
agenda.
Exactly.
Thing that they're
Exactly. There are instances, however, that even once you actually stop Plaquenil, you can actually continue to progress to have vision loss afterwards. There was a study, however, that of 400 patients who actually took long-term Plaquenil, and dosing is tough too because every patient's different. But it was kind of an average dosing that they actually only found 2 patients to be effective with retinopathy because of it. And they were both after 6 years of treatment. Anybody have any questions on Plaquenil? I thought we would.
Questions? It's a lot to digest.
So here's another fun comic. Autoimmune disease is probably my all-time favorite, because the only thing tough enough to kick my butt is me. Stupid immune system. So really the conclusion of the information is lupus and its effect on eyes may be sight-threatening and can be an indicator of active systemic disease. Early detection can not only be sight-saving, but possibly life-saving, since a lot of times they can actually, we talked about this briefly too, that you might not have any symptoms, but they might find something going on that is actually a sign of other inflammation going on systemically. Better to catch something as soon as you can. So again, to reiterate, it's recommended that patients with lupus have annual dilated eye exams regardless of symptoms. For patients with normal eye health that are lupus, further testing is actually not usually performed. However, some doctors will recommend baseline testing. So normally what they'll test for if you're a lupus patient is a visual field, and it's a specific one that's called a 10-2, and a optical coherence tomography test that actually takes pictures of the layers of your retina and actually can show inflammation, or even if you've got like fluid kind of building up that may not even be found in a dilated eye exam. So regardless of signs or symptoms, they'll usually do these within especially 1 year of starting Plaquenil. For patients who start to exhibit signs of eye disease and or have been taking Plaquenil long term, this testing is crucial and should always be performed. So even if you are seeing an awesome ophthalmologist, everybody makes mistakes. Speak up. And maybe say, because every doctor is different too. There's some doctors that it's in general might not be a big deal that you actually have this testing done. If you're not using Plaquenil or if it's not necessarily long term, but better safe than sorry.
Yeah,
definitely speak up.
And do all ophthalmologist offices have these visual field tests and the other test you're mentioning there?
Not necessarily.
Okay.
So yeah, we want to make sure that who you're seeing, or even if you've got insurance, maybe contact your insurance company to get a list of local ophthalmologists and even look into it, do some research, call the offices to see if they actually have this testing.
And even if you don't have eye insurance, optical
this
insurance
actually
would be medically covered.
Yeah, none of this would be actually considered a vision issue. Okay. This is all medical. So if you have medical insurance, this is should be a covered benefit. Just making an appointment and stating I have lupus.
Yeah.
Means you have a medical issue.
Okay.
That needs to be followed. So I've got a list here. So regardless if you have lupus or not, but especially for us luppies, you want to make certain to contact your ophthalmologist as soon as possible if you experience any unusual symptoms, especially any of the following. Sudden vision loss, pain, increased sensitivity to light, a curtain over your vision. That can either be it could be like complete blackness that's a curtain, or almost like a veil. So any kind of curtain that you're seeing over your vision is definitely a huge red flag. Increased floaters or spots, we kind of discussed that a bit. Flashing lights, increased redness, sudden double vision, loss of peripheral vision, so your side vision, loss of central vision, and of course, bleeding in any area in or around your eye.
Let's hope you think to go to the doctor. If you have any other
especially, yeah, but you'd be surprised.
I know, I'm sure.
Or
I'm guilty.
You'd be surprised at how many patients wait until Friday at 4:30. I've had this problem for 3 weeks. 3 weeks is way too long, and you're talking about irreversible. Yeah. So you are actually your own loopy vision advocate. You want to ask your rheumatologist, which is another a great hint. The tip is to ask your rheumatologist for a referral to an ophthalmologist if they would know who locally has up-to-date technology to be able to evaluate your vision for any problems, and that we really know kind of signs and symptoms and issues that are involved with lupus. Educate yourself on diagnoses and medication, especially side effects. That one's a tough one because everybody uses the internet, and the internet is not always correct.
It's often as dangerous
exactly.
as it is helpful.
It's very important to have a good relationship with your doctor, and even have maybe keep a copy of your medical records so that even you can monitor your changes. You, as a patient, are entitled to your medical records. It's kind of good. You never know what we kind of discussed, that sometimes you never know what happens with your doctor, whether it's your rheumatologist or your eye doctor. I think legally they only have to keep your records for 7 years. So if you saw a doctor 7 years ago, your records are long gone. So that would be good too, so that you can actually kind of keep an eye too. You might go to the doctor last year and your vision was pretty good. This year you go, they tell you that your vision was pretty good, but you just feel like maybe there's something going on, that you can actually look back and see the difference. Or it's always important, if you have to go see another doctor, to take your records with you so they can, especially if you've got those baseline testing, to make sure they can monitor any changes. And if you're not receiving the highest quality care with either of your doctors, we talked about how we're lucky here in Salt Lake that we have so many great doctors. Find another one. Get a second opinion, get a third opinion. There's no reason why you should lose vision or have health issues because your doctor is not taking good enough care of you. So, of course, another comic. I may be chronically ill, but I'm also chronically fabulous. And then the very bottom one, I've got covered here. Let's see. It's going to go away.
Yeah.
But I believe it says, pay close attention and trust your body and trust your eyes.
Yeah.
A lot of us with lupus know how it feels to go to the doctor for 10 or plus years, for them to tell you nothing's wrong, that you're fine, maybe you need to eat better and get some exercise. Come to find out you've got a chronic illness and your body is attacking itself. So you know more than anybody to pay attention and trust how you're feeling. If you go to the doctor, I think you're good to go. Speak up and or find another one.
I always tell people, a plumber came to your house and didn't fix your leaky faucet, you wouldn't have him hire him to come back, or
absolutely,
and you'd find someone else. So,
and this one's a little more important.
Right, exactly. Yeah, much more important.
And then, of course, lastly, we have some Willy Wonka. So you liken your stress-related stomach aches to my incurable autoimmune disease. You must know exactly how we feel.
Yeah, we were just talking about that. That's so true.
So thanks everybody for joining. Hopefully everybody heard okay.
Are there any questions? Anything that's come up? And Natalee has included her contact information on this last slide, but I will also put it on our website with the other thing we talked about. What is it called? Oh, yeah, okay. I knew there was something I was putting out. And then, so if you have any questions, feel free to reach out and ask them. And, feel free to print out the webinar as well. We'll have it on the website so that you can ask the right questions when you go to the doctor and have a better idea of what you're talking about when you use those big words. And totally impress your eye doctor.
Absolutely.
Go in and
this patient knows what she's talking about.
That's right. I better take her seriously. Okay, well, if nobody has any other questions, then thanks everyone for listening, and we will post this up on our website soon. Like, there's a round of applause. Yay! There's 3 people in the office. We